Hey friends, my name is Paige and I am a member of the SM Nursing Reviews team. So by now, I know you're probably well versed in a head-to-toe physical assessment, but in case you need a refresher, we have an entire video breakdown of a physical assessment within our crash course, so be sure to check that out if you need to. But this video is going to take concepts from there and apply it to a next-gen NCLEX style question. And today we'll be covering the matrix multiple choice. So let's dive into a practice question and see how these questions work. Remember, the more practice that you have with these different styles of questions, the easier it's going to be on exam day. So let's get started. So what is a matrix multiple choice question? In these questions, you're going to be given a client scenario and then a grid as your question. So most of the time, the grids will have between 4 and 10 rows and 2 or 3 columns. You'll simply go and you'll find the correct response on each row, and you can only select one response per row, so don't stress about that. The options, they might be related to orders, assessment findings, treatment options. So you may be asked to review physical assessment findings or treatments, and then essentially label them as effective, ineffective, unrelated, or you could label them as improved, declined, unchanged. They might also give you medications and ask you what is essential versus what is contraindicated. So just remember, each row must have one correct response, and the student can only select one response. Let's go ahead and apply this to a scenario, as seeing it is going to make it all make a lot more sense to you all. Okay, so let's meet our client. So a 45-year-old is admitted to the hospital after suffering from cholecystitis and a subsequent gallbladder removal. Her surgery took place on the shift prior to yours, and she's complaining of increased pain at the suture line. She rates her pain as 7 out of 10. She's also been following a clear liquid diet and will be progressing to a normal diet today. She indicates that she is passing gas and has been voiding regularly without issue. Okay, so let's take a look at how this question would look. From the following selections, I want you all to select the component of the physical assessment of your patient at the beginning of the shift and indicate whether it is effective, ineffective, or unrelated to her main complaint. So I want you to go ahead and pause this video if you need to. Give yourself a minute, look it over, and answer this question. When you're ready, I want you to go ahead and hit the play button, and we can walk through this together. So take your time, look this over, pause if you need to. Okay, so hopefully you had a chance to look that over and make your selections. Here is your correct answer. So under effective, we have measure vital signs, inspect suture line, and palpate suture line. Under ineffective, we have percuss abdomen. Under unrelated, we have auscultate heart sounds, inspect capillary refill, and auscultate abdomen. So let's go into each of these categories a little more. Let's talk through this. So first, we're going to break down what are the effective strategies to assess our patient. So since our patient is complaining of increased pain at that suture line, and her surgery was completed the day before. So what is one big risk of surgery that we're always on the watch for? Infection, absolutely. So one of the most important items we want to rule out is a possible infection or a wound complication, since that pain is localized right at that suture line. So how would we do this? We could definitely measure her vital signs, looking for signs of infection with an increase in temperature. We could also inspect and lightly palpate the suture line, looking for symptoms of infection like redness, swelling, or warmth at the site. As well, this would also allow you to see if there was any evidence of drainage or wound opening, which is also known as dehiscence. Okay, so our ineffective strategies here would be to percuss the abdomen. So let's review, why would we want to percuss the abdomen in the first place? What does this tell us? Percussion would tell us the estimated size and density of organs, as well as the presence of fluid or air in the abdomen. So this assessment technique does not directly relate to our client's complaint of pain at the suture line. In fact, percussing may actually increase her pain as well, making this an ineffective assessment technique for our clients presenting concerns today. So moving on, let's now address unrelated assessment categories. So these will be auscultating heart sounds, inspecting capillary refill, and auscultating the abdomen. So why would we perform these techniques? Why would we auscultate the heart? This gives us valuable information about the rate and the rhythm of the heart, of course, as well as listening for extra heart sounds, murmurs, and it gives us a good overall indication of the cardiovascular status of the patient. All of that is true. Why would we perform capillary refill checks? When we check capillary refill, we're able to assess the patient's circulation and perfusion to the extremities. This is also going to give us valuable information related to the cardiovascular status of this patient post-op. Now, why would we auscultate the abdomen? Well, with this, we're able to assess bowel sounds and look further at the patient's return to normal GI function, which is our goal, right, after surgery. So all three of those, of course, those are very important parts of our assessment to complete after a client has had a surgery, but those three specifically, they don't directly pertain to the complaint of pain at that suture line. Instead, due to our client's concern and also their presentation, we would need to complete a more focused physical exam for sure. Okay, great work on that one. So this question, that was an excellent example of the structure of some of the questions that you might see on your next gen NCLEX exam. So as we said before, this type of question, it's called a matrix multiple choice question. So let me walk you through really quickly how it will be scored. So for each assessment technique, you're required to select effective, ineffective, or unrelated. For each correct answer, you're going to receive 1 point, and for each incorrect answer, you'll have a point deducted. So in this situation, there's 7 assessment techniques here. You have the chance to score 7 points total. In any question on the next gen NCLEX, you can never score less than 0, even when points are being deducted, so that's good news, so don't worry about that. So if you missed this one, it doesn't subtract points from your overall passing score. So these types of questions, they're actually a great opportunity to rack up as many points as you can in your favor, and points will not be deducted from your overall score. So always remember, give every question your very best effort. Okay, so this is a little fun. One last little bonus question here. So when we're performing an abdominal exam on a client, what order do you perform it in? Now I want you all to think IAPP. Imps ate purple papaya, and you see our little imp and papaya there. So we start with inspection, then auscultation, then percussion, then palpation. So if we were to palpate or percuss too early, we can alter those bowel sounds. Great job, everyone. You have absolutely got this. We are rooting for you. Happy studying. And remember, you will pass.